Welcome to Be the Category of One. I'm Jenn Brown. Each week, we explore growth, mindset, and leadership because standing apart starts from the inside out. Dr. Rydstrom, welcome. It's so good to have you here today.
Thanks for having me. I appreciate it.
A few things when I was driving on the way in for today's presentation, I was remembering back to when you applied for the position at Babylon Dental Care. I think you interviewed with my husband, Cliff, Dr. Cliff Brown, and Jacqueline Cooper, our clinical director. So they call me up after, and Cliff's like, Jenn, this was the best interview ever. And he's done a lot of interviews. We all have done. We're almost, I want to call it like interview fatigued.
Yeah.
And everybody, and again, this is not you because I think you're definitely very special and unique to us, but everybody has an interview that they put on. You know, it's almost like, I find, especially with dentists, it's like stepping on stage a little bit. Yeah. Kind of like when you go into an operatory, you're on. 100%. You know, so I think that dentists in particular do interview well for the most part. Yeah. But they were so blown away and specifically, it was how naturally your enthusiasm and value system seemed to, without even you fully knowing about our value system, it was like a perfect match. Awesome. You know, Cliff's like, it was like, 40 years ago, seeing myself in an interview type of thing. And he was really blown away. So, and then when I spoke to you, it just all made a lot of sense. So we were really excited that you made the decision to join us.
Yeah. And I'm ecstatic as well.
Yeah.
I think you guys made the decision easy for me.
Oh, I like that.
Yes, it was tough. So I'll tell you a little bit about my past and my history about dentistry. So when I came out of residency, I worked in Manhattan and I was there for 2 years. And I worked there Monday through Thursday. Every Friday, every other Saturday, I would come home and work in East Islip for more like a full mouth rehab, more cosmetics. So did a lot of commuting. And then me and my wife, we got married and bought a house in Melville, came to Long Island. So then I was looking for jobs in Long Island or potential partnerships, whatever the opportunity was. So I found you guys. And when I interviewed, you guys blew me away. And the reason for that is, like you said, the ethics and the values aligned even before even knowing the true culture of the office. And it was basically what it came down to was treating patients like family is the number one thing in my heart. Because I have a big family. I have 3 older sisters, 6 nieces and nephews. My mom's one of 9. We have like 40 cousins.
And where'd you grow up again?
Islip, New York.
You did, okay.
So I grew up in Islip. Okay. And then I went to University of Delaware for college. Mm-hmm. I went to Temple Dental School for dental school. And then I went to NYU for residency, for 1-year residency.
How'd you like living in the city?
I loved it.
Yeah.
I loved it. I think for a young couple, young male living in the city, it's like going to college again. All your friends are like 5 blocks away from you. Right. So after work, you can do a nice date night. You can go out. You can see your friends again.
You have that city energy in you.
Oh, yeah. High energy.
Still.
Always. Will never leave me.
How do you like living on Long Island now?
I love it. I think the city was great because, like I said, you can do anything and you have so many friends there. Living on Long Island was more like calm. But then again, I brought the energy because we were building a house. So still late nights, still had a lot of fun, still in the house. And now we're finding our niche now. We're finding our places we go to. Now I'm getting into pickleball, so my energy's back into another little sphere. And we love it. We're very happy with where we are. And we're near family. That's like the number one thing for us. So I'm 20 minutes from my family, and we're 20 minutes from my wife's family.
Oh, that's perfect.
So she's from Roslyn, I'm from Islip, so it's very easy. Sunday dinners at my house, Wednesday dinners at her house, and it's been great.
So we love that. Very nice. Yeah. So I'm excited today because I have my parents watching the podcast, which is really neat. And it's funny, it brings back memories. When I was driving here, I was going through things in my head, and growing up, my dad's best friend was Dr. John. He was like the local dentist at the end, on Wheeler Road in Hop and he had an office out of his house, and he would, treat us, and then also like every night be in my kitchen, smoking cigarettes and hanging out with my parents late at night. But my fear of the dentist actually came from that relationship, ironically, because he was, no hygienist. So if I had hygiene, I don't necessarily remember having hygiene.
Yeah.
But the few times that I do remember being treated by him when I was young, a ton of cavities. Like every time I'd go in, it was like 8, 9, 10 cavities. So the drilling was just crazy. And again, while I think he gave me Novocaine, it's not the same. Like the gum Novocaine before the Novocaine
Totally.
now,
Yeah.
that
Yeah.
wasn't a thing back then. And I mean, one time I remember being on spring break in Puerto Rico and I got an abscess.
Oh my God.
And I returned home and he pulled my wisdom tooth out. It was so infected though.
Wow.
I don't even think he probably could numb me. I'm going to assume that. He literally, like on a Sunday night, we ran to his house. He's pulling the tooth out, cigarette.
Thank God it's not in your kitchen.
No, it wasn't. It was actually at his office, but but it was like being in the kitchen, cigarette on the counter. It was just crazy. But what was so weird is even though we knew him so well, I developed such a massive fear of the dentist because every time I went, I had to have a crazy amount of work done. You were saying like earlier that you had great teeth and your sister had a lot of work. It's like random, but it was just so strange that I really, when I met Cliff and he told me that he was a dentist, I was like, this has to be a joke.
Yeah.
I was like, yeah, right. This is the universe playing a joke.
That's the man you're with now.
Yeah. Now
the one
my
you
husband,
feared your whole life.
Yeah, the one I feared my whole life. I ended up marrying, but so I just thought it was the most random thing. So fast forward, I get with Cliff and we're dating, we get married, and I was a school teacher. And when I had my daughter, when I was thinking like I was ready to go back to work, Cliff was like, help me out in the office and market. You have an amazing way about with people. You understand the consumer. You understand people so well. And you have this unique thing that you just don't like dentists. That's my space.
Yeah.
You understand how to speak to someone who is anxious about dentistry.
100%.
So I was like, that's so weird to me. But I went ahead with it, because I was like, all right, it will be easier. I could work from home, back then remote working, my daughter's 22, so that really wasn't a thing.
How long ago was that?
20. Well, she's 22.
20,
so
yes, that wasn't a
so
thing at
maybe
all.
when she was 5, I was looking to go back to work.
Yeah.
So remote working wasn't a thing. And if I was going to pull myself out and go back to teaching in a school district, why not work from home and be able to be available for my daughter? So, I started studying and learning about dental marketing and marketing in general. And I really liked it because I became passionate about, especially in the practice, because marketing for our organization was never about putting a piece in the mail.
Yeah.
It was also about making sure that the service and what we're creating for the patient, that experience part of our beliefs, creating an experience that exceeds an expectation, what we're doing to do that, between, I don't know if but I built that practice. So the wall covering, having wall covering, the color selection, all of those things go into the environment where someone who has dental phobia can come in and kind of decompress because the space is very warm. It's very welcoming. It's very pretty. It removes that anxiety pulsing, head, like having, I'm sure you've used it with patients, but the comfort menu.
100%.
And then that goes into the one thing with you, with music and dentistry, like having music and the station selection. Like I know in Great South Bay, we don't have it now, but in Gateway Plaza, we do have Sonos where it's on the comfort menu that our patients can select the type of music they want to listen
Which
to.
I love.
I love it too. I now can sit in Gateway and go through a hygiene visit, and I get all into the music. I know we were talking about that earlier. So, but anyway, so it's like
it's full circle moment.
Yeah, having you here,
100%.
100%.
Yeah.
So talk to me about what drew you specifically to dentistry, because you're a bright guy. You probably could have done anything. So why dentistry?
So growing up, my grandfather was a dentist. He actually retired at 90 years old. So my whole life, we were going to him for cleanings. And fortunately, I never had a cavity with him. So going to him was like my favorite place on earth because he made it fun. It was 2 seconds. He cleaned my teeth. And on the way out, he would say, go grab a can of soda and some peanut M&Ms. Which, looking back, it's like, why would he do that? That's causing cavities. But it was great marketing at the time, you know? He probably was like, listen, go get a can of soda and cavities. Hopefully he comes back with a cavity. But anyway. But yeah, he made the dental office so safe for me and a place that I loved.
I love it.
And when we went to the dentist, it was like visiting grandpa. It was like a full day. You went to see grandpa, and then sometimes you'd go back to the house and have their Italians. So you'd have pasta, play in the field. So it was like a very good like mini vacation from home. So he inspired me. But my whole life, my mom kind of whispered in my ear, like, be a dentist, be a dentist, be a dentist.
That was
be a dentist.
her dad?
Yeah, that was her dad.
Okay.
My dad is in construction.
Right.
His parents were into construction. So the joke is with both families is I do construction of the mouth. So that relates my grandpa from my mom's side and my grandpa from my dad's side. So I'm doing construction, I'm in the mouth, brought both together. And that's
was your grandfather able to know, was he alive to see that you went to dental school? Is
he
alive
was.
now?
He's not alive now.
Okay.
He passed away in 99.
Okay.
He lived a great life.
Yeah.
I would sign today for his life.
Yeah.
And I remember he had dementia later on.
Uh-huh.
But when I came home after taking my dental admissions test, he was there when I got the results.
Oh,
so I don't know, he didn't probably fully remember, but for me, having him there was amazing to see him. And like I said, a full circle moment. My mom's there that told me to be a dentist my whole life. My grandfather's there, and then he saw my results, and we
Where
knew,
did he go to dental school?
I think Marquette Dental School he went to.
Wow.
And he loved it, really loved it. And one thing that
Marquette has a really good program.
Yeah, great program. One thing he taught me was to treat people like family. They're old school Italian. He had 9 kids, and every night it was family first, family dinners around the table. He would count the heads, make sure all 9 were there. And that's what he kind of instilled in our family was like, okay, your family's everything. And that's the same thing you want to bring to patients. He always said, when you have that patient in the chair, that's your mom, that's your dad, that's your grandparents, your sister, your brother. And that's the same kind of energy you want to bring to your patients.
My husband will add the sister, the brother, the mom, the dad that you like.
Yeah. And the favorite uncle.
Yeah.
He loves that. The favorite uncle.
You've heard it.
I love it. I love it.
It might be on an epitaph someday. I don't know.
It might be. It's like the quote, the favorite uncle.
That's really funny.
Yeah.
Gosh, I have so many questions for you. That's so interesting. I didn't think about. I never thought about a visit to the dentist like that. And it's funny because I don't know if you've been in the office when my grandkids have come in, but like Aria goes and she's he'll say, come sit, take a ride. He's only counting teeth at this point. She's 3, but she puts the glasses on. She gets in and she's so blown away by it.
Yeah.
But she's not really into. I ask her, you want to be a dentist when you grow up? She says no. Yeah. I said, okay.
What does she want to be? Does she know yet?
She doesn't. She doesn't say. She doesn't say. But I keep saying, you want to be a dentist? And she's like, no. She knows that he's a dentist.
100%.
And
yeah.
But she's just not into it.
Yeah. Listen, it got me. My mom got me. My grandpa got me. Another cool thing was he was so old school. Retired at 90.
Yeah.
That he
retired at 90.
Retired at 90.
Did he have an
Brooklyn,
office in his house?
In Williamsburg. No.
Oh, okay.
No.
Separate. Okay.
Yep. In Brooklyn, in Williamsburg. Worked there like every single day of the week. And he had not digital x-rays. So you had to dip them in the fluid.
Yep.
Hang up the x-rays.
Oh my goodness.
In a dark room. And then eventually you would see the x-rays.
Wow.
You put it on light. So he would bring me and show me the experience of take the x-rays. Let's go in the dark room. Let's hang it up. Let's now look at the light. And now you can see your teeth. So that whole experience, like, wow, this is a really cool field.
Yeah.
And it stuck with me. And now look at me.
Yeah. Did he, and he had a lab in his office?
Yeah, a small little lab that he would like do adjustments to a crown or adjustments to dentures, but he would send most of his work out.
Right.
Yeah.
Interesting.
Yeah.
Very nice. I like that whole feeling of it.
So that was my inspiration, was my grandpa.
So how's it been transitioning?
To Babylon Dental Care?
Yeah.
I love it. I think when you guys work at Babylon Dental Care, you don't see what you've made. And what you've made has been amazing. It made it easy for us to transition in. Personally.
I really appreciate hearing that from you because for me personally, I'm always about what more I'm moving to.
Yeah.
Like yesterday, I was mentioning to you earlier that we had our quarterly leadership workshop.
Yeah.
So we get all the leads in a room for the day, and we kind of workshop what we've done first quarter and where we want to go to. And one of the things that I'm really struggling in leadership is I'm always thinking about the next thing,
Yeah.
and I'm not celebrating the win. So, and again, because I'm mostly remote, because if I'm in the office, I won't get anything done.
Yeah.
I don't always get the sense or the opportunity to hear what's going on that granular level and appreciate the win of it.
Totally.
You know, I love, randomly I'll speak to a patient and they'll talk about the aesthetic and how beautiful it is. And I'm like, oh my God, I built that place. I picked out everything like on my floor, but I don't do that enough. It's a very, very bad trait that I have of myself. I'm always like, all right, check that off.
No, you got to celebrate the mini wins.
Next thing. Yeah. I'm always going. Yeah. So
because you guys have a lot of mini wins. I don't know if you even see, like, for example, I came from Manhattan, like I told you, worked there for 2 years. Great experience. I worked in East Islip as well. Amazing guy. I love him to death as well. But the transition from, there were smaller offices to my first bigger office. Obviously, we have a lot of hygienists. We have multiple doctors. Coming there at first, I was like, wow, this might be a hard transition because I'm not used to it. But I had an ambassador program where I had guidance
I
to
love
help
that.
me.
I love that program.
To bring me on, that asked me questions. Once a week, we'd meet for lunch. Once a month, they would go over, okay, what have you improved on? What did you like so far? How can we make your experience better? I mean, that helped me a lot because I needed to get used to, one, wearing a headset while doing dentistry. Because now the communication skills is huge.
The headset over the year has been either everyone loves it when they understand what it does for the care.
It's incredible.
Well, and patients think it's bizarre. Most patients understand it, I think, because it's such a big office. But there have been patients and they wear headsets. It's such a huge organization.
It's a huge advantage.
I mean, one patient probably is touched by 15 people.
Yeah.
So to make that seamless, it's almost like being on stage.
Yeah.
You have to, have someone choreographing it in the background and, letting people know what's going on. Yeah.
I think the biggest advantage of the headset is this. Like when I worked at other offices, if hygienist was done with the hygiene check, they would come in your office and say, Dr. Rydstrom, I'm done, or give you a signal that they're done without trying to tell the patient. But the patients would always know. Now you have direct communication in your ear while working on a patient. Instead of telling the patient in the chair, listen, I have to leave you because I have to go see another patient. It's like, you know what, let's give you a 2-minute break. Sit up. My attention's still on you 100%. I'm just going to give you a 2-minute break. It allows me to do a hygiene check and come back, and that patient never even thought that I went and left that room. Right. It's like, this is my break. He's going to come back and treat me again.
Yeah, because, I think that the patient, especially in a larger space, West Babylon has 15 ops.
Yeah, it's huge.
Yeah. So patients don't realize that it's a production. There's a lot of key people that are moving in and out to serve you. But there's also other people that have to, at the same time, be served. Yeah. So it's all like this flow. Yeah. And the headsets really make a difference. I mean, Cliff would never wear a headset only because when we came up with that whole program, he was so far into, he has a lot of the ringing in his ears from the drill from all those years.
The high-pitched noise.
Yeah, so
everyone loves it.
That really interferes with what he was hearing. So, but his assistants would wear and then communicate with him. But it really makes a difference when the provider knows what's going on, because then you can totally anticipate being present for this patient, but knowing that you need to pop in and be present for another patient, because it's just how we don't want anyone to be messed up on timing, right? Yeah. We want their visits timely and smooth, but we also want to give them the attention that they really require and need from us. And that's the easiest way to do it, knowing what's going on around us.
And with an office so big, you have so many patients. So for example, there's days where we have 2 columns ourselves as a doctor, and we have 2 or 3 hygienists towards our name. So we want to give the patients the best care. So not just hygienists and us, it's also our assistants that wear headsets. Yep. So when we're in hygiene room, our assistant will say, hey, listen, room 5's ready for you. So now I know when I leave this room, I have to go directly to room 5. There's no break. It's smooth sailing. Which
is great because you're not having the patient wait. If you went back and waited till someone grabbed you, that's 5 minutes.
Exactly. Yeah. So it's great. So that was a big transition coming. Mm-hmm. And then also we'll get back to the ethics and the values. So when I did my interview with you guys, Obviously, I didn't know what to expect. When I walked in the office, I'll be honest with you, at first, like, oh my God, this place is huge. Like, I don't know if this is like for me, it's huge.
When I was building it, I had rollerblades,
Yeah.
and I used to go back and forth because it was like just walking that hall it's long.
Yeah.
It's a long run.
It's a long run.
Yeah.
So at first I'm like, is this corporate? Is it not corporate? So I'm like, let's just keep going with the interview, see how the conversations are. Looking around, the hygienists were all smiling with patients, happy. Assistants seemed happy when I was there. I didn't know anyone, but just looking at people's faces, shook everyone's hand, made sure I got to know them a little bit. Then when I sat down with Dr. Brown and Jacqueline, that's when I knew this was for me. I mean, because once they said that the value is more for the patient of treating them like family, right? And we're here to help you support, to give that care to that patient. That's when I knew, you know what? The values align here. Like, you have my back. You're on my team to succeed at this office.
100%. I mean, listen,
but you don't find that everywhere. That's the hardest part.
Yeah, I mean, yes, I can go to that space with you because I was a dental consultant for a while too when I was doing marketing, and I would be in a lot of offices, and doctors would want what we had. They'd pull me in because they want me to recreate what we had, but they themselves didn't embody what Cliff's philosophy was. So I can't get your staff to be like what we have, because it's just it's an infusion that just goes down by someone living and breathing and showing. It has to
be an all-in mentality.
Yes.
It has to be.
But it's funny, like, how did we get so large? Like, some of our patients from way back, that when Cliff originally started, he was in TSS stores. I don't know if you remember.
No, what is that?
Is Times Square stores. It was.
Am I that young?
You're that young. But it was a big like a Macy's, Bloomingdale's.
Okay, those I know. Yeah.
But oddly enough, it had a dental studio in there.
Yeah.
Okay. So Cliff was working for he was running 3 of them, but one of them was across the way in West Babylon from where we are now. And they said to him, they wanted him to buy in as a partner, whatever. And he just wanted to, he just loved treating people a certain way. And he didn't see that was going to be in full alignment with corporate people owning it. Because that was like a way old version of corporate that was going on. So he moved to a location, 76 Route 109, which was a little bit up on 109. And I think he had 3 ops he built out. He took a note. I mean, the interest rate was just insane. Our story's out there. But by the end of the first week, he had to hire an associate. Wow. He hired another front desker, and it just kept growing and growing and growing. And when I met him, he had 6 operatories at 76 Route 109, but he had room for another 3. So we built it. We went in, we built it out. And then what happened was, which made us get into the market to build the practice that you're in today, our new patients were bopping out. Like, we were booking at 6 to 9 months.
Wow.
And he was just like, Jen, we need more room. And I'm like, do we get more room? Do we open up like a satellite? I didn't know what to do. So I went out and scoured the area. And if you know that area, I just think that the Great South Bay Center is the most beautiful place you can be there.
For sure.
It's just beautiful. It's in a nice location. All the stores are really, really well trafficked and run very nicely. And the landlords were real great people.
That's great.
So they didn't want us. They were like, no, we don't, dentistry's not the best to have in a shopping center because of the build out. Yeah. So I tore up their cement and all that stuff, which is they don't typically like to do build outs like that. But I'm like, no, it's big. We have a lot of foot traffic. I mean, when I was doing my pitching plan for them, because they really didn't want us, my foot traffic in the old location was more than what Marshall's had at the time.
Wow.
So I was like, we're going to bring people to the center, which wasn't part of these corporate guys' head. They just didn't have that in. And again, when we did that in 2011, corporate was not what it is now.
Yeah, no.
So that was like a very, a plan that no one had heard, that business model. So, but we are corporate. We did our job so well that our patients I'm going to say forced us to
Yeah.
make another plan.
For sure.
And then the reason why we ended up in Patchogue was the same thing. But at 15, I was like, we don't have it in us to run something bigger than this.
When did you guys open Patchogue?
I think it was 7 years ago,
Okay.
7 years ago
Yeah.
now. Yeah. So we were at that point too, where again, like so many patients were booking out. And when we looked at our patient base, we had a lot of people coming from like East Islip, Great River,
Yeah.
Bayport, Sayville. So it made sense. Why don't we get into a center that's well trafficked? Again,
Totally.
we'll stay on
Yep.
Sunrise Highway because Sunrise to Sunrise, it's not a far stretch between both locations.
Yeah.
And we stayed within our market area already from our patients, right?
Yeah.
Because again, I think how we branched out going east was we were so branded in the West Babylon location, but I think families were moving east for better homes
Yeah.
and lifestyle.
Yeah.
So, and those areas are up and coming.
Totally.
So,
And it's more affordable, which is great. It's
yes.
great.
So, again, when I found Gateway Plaza and I met the landlord, the Pergamon family, they were just, it was like a dream. I'm like, this is such a great shopping center. Again, I think I'm going to bring foot traffic. They had foot traffic for me because, again, we weren't branded in that area.
Yeah.
But there weren't a lot of dental groups like ours around. You know, one of the things that I really am passionate about that we've created, and I guess I'm proud of, I'll celebrate it with you. I love the fact that we're able to have so many in-house services for the patient.
Yeah.
So like the mom doesn't have to take her kids to another practice,
Yeah.
right? We have, I mean, Dr. Baker's been with us for years. He's a
Yep.
mensch, a great guy. Dr. Azin's phenomenal. So we've got ortho and pedo covered.
Yep.
So mom can stay in the same practice. You know, the airway health, which
It's
is huge
Yeah.
right
and
now.
it's growing a lot.
A lot, and helping so many people. You know, and then again, we'll rebuild and get some endo in house because I think endo is really important.
100%.
The only thing we're really referring out to is oral surgery. I mean, perio, having Dr. Knackle is spectacular.
Yeah.
I mean, and he's again full time with us.
Yep.
And
And he does most extractions.
yes,
He does mostly everything. I think
Yes.
oral surgery is more we do like immediate care if he's not there or impacted third molars.
correct.
That needs to go to oral surgery.
Correct. And he's phenomenal.
The best.
I mean, the ethics and just his clinical skills are really
Yeah, good guy.
yeah, and you know, when you have someone around for a long time, you get to see their work. I mean,
Totally.
again, dentistry, and we were talking about this earlier, dentistry
Yep.
is not something that you're one and done forever.
Yeah.
Things happen. It has nothing to do with the quality of the dentistry, but
Yep.
someone's mouth.
Yeah, it could be
anatomy.
biology, genetics,
Yeah,
for sure.
So, but yeah, so that's how we ended up, you know, with such a large practice.
Yeah.
And I think we're doing really well with it. I think that we have the right people to support the exact size and everything that we have.
Yeah.
I don't think we're for everyone in the dental field, in the sense that I don't think that we're for every dentist.
No. Can you elaborate on that? Because I think the same thing. So what do you look for when you hire a dentist?
I think, look, I'm not a dentist, so
Yeah.
I don't want to make like an obnoxious
So clinical skills aside.
or rude
Totally.
or disrespectful dental
Yep.
comment to you, because
Yeah.
I respect
Yeah.
you know your degree and what you do tremendously. But from working with dentists like I have, and again having to make those capital calls of like, this person's not for us, because
Yeah.
again, I have to advocate for our patients, and if something's not in alignment with everyone else that's treating, it's not the right fit. Even though I might
100%.
need the dentist,
Yeah,
I can't.
totally.
I don't have that luxury because I have to answer to our patients.
For sure.
Okay, so for me, finding the right dentist, I think there are some dentists that go to school, and schools are a lot of money, and I think their belief system is they're going to land in this Park Avenue type practice where they'll do, you know, good work, high quality, high fee, but not high volume. And I
Yeah.
think there are some dentists that don't look. Some dentists will not wear an earpiece, that, you know, and don't want to juggle 3 hygienists, 2 ops,
Totally.
2 assistants. Like, you know, we have to have dentists that want to do reps of dental work, right?
Yeah.
So I think there are a lot of dentists that come out and they're like, well, I don't want to do reps. I'll do less at a higher fee.
Yeah.
And I think that has to do with not. I don't think that the dental schools necessarily talk to you guys enough about the business decisions that they're going to come for you.
100% agree.
Yeah. And they don't give you the skills to analyze how to make those decisions based on the type of provider you want to be.
Yeah.
Like you working in our practice and seeing, 30 patients a day versus someone who goes to a Park Avenue type situation and sees 10. It's the same thing. It's the same thing. You're working in your clinical skill. You're relationally connecting the same way. There's no difference. It's all about what you bring. Yeah. It's just how many times you want to do a filling. How many opportunities for a filling do you want to do? And that's what I always say. And I think I said this to you. I have a lot of opportunity for you. It's not about chasing the dollars. I don't ever talk to a dentist. But when I say opportunity and I'm interviewing and the dentist goes to my fees and the dollars, it's not going to work.
No.
It's not going to work. I have a load of opportunity for you.
Yeah.
And again, you set the tone and the pace because we speak to you about how you want to be scheduled.
Yeah.
We have you create your scheduling parameters that are most respectful to where your skill is at and what you want to do and how and the environment in which you want to do it.
Yeah.
We don't force that on you. That's the difference between us and corporate. But I do think that I think that people get caught up in the dollar of it and they relate it to their service.
Yeah.
And that's hard because our practice is not based on that.
No.
There's plenty of times, and I've said it in the 2 other podcasts that I've done, there's plenty of times where to do right by a patient, I'm giving them a credit and sending them flowers and thanking them for the opportunity to fix this, you know? I don't think that many practices would advocate for that in the patient relationship.
Yeah, no. And that's what's important, is the rapport you build and the trust you gain from patients.
Yeah. I mean, I sent flowers a few weeks ago to a mom who I know she's not coming back to the practice, and I'm okay with it. I get it. We definitely dropped the ball. I mean, when you have that many people working together to serve something, and by the way, sometimes we're just not someone's cup of tea, which is fine too.
Totally fine.
I want her to be happy, but I did send her flowers because I was really grateful for her that she took the time to talk to us and showcase to us what we could have done better.
Yes.
And that was a great teachable moment. We brought everybody who was involved in that in, and we talked it through, and each person was like, you know what? I could have done this. Next time I'm going to approach it this way. It was a massive learning. I can't even create those scenarios to walk through with a team member.
Yeah, no.
So sometimes the cost is we're going to lose a patient, but I'll take the value of it.
Totally.
Because I know that they're going to remember it.
Yeah.
And I remember it too.
And you learn from it. Mm-hmm. But it just makes you better as a business owner, as a doctor. I mean, talking about dentistry, when we go to dental school, all we're taught is like the clinical skills. You're taught how to do the perfect preparation. What is a root canal? How to do a crown. You're never taught the business and the reality of dentistry. And that's why I know we're going to get into it, but I'll get into it now, that's why I released this podcast called Truthfully Speaking. And it's just the realities of dentistry. What dental school doesn't teach you outside. Because dental school only teaches you the basics, like I said, the filling, the prep, scaling, and the science behind why we do certain dentistry. But when you come out as a dentist and you're in the real world, number one, how do you know what job is right for you? Is it the private practice on Park Ave where it's 1 crown every 3 hours? Yes, you'll make a great living, but that's your fee for service, right? High clientele, you can do that. Or do you want to stay busy and do 4 crowns in a day, 10 fillings, run with hygienists? For me, I've done it both. I'm loving where I am now because I'm very high energy and I like helping as many people as possible. So that's why the transition here also made it easy for me. So these are things that we talk about on the podcast to teach other dentists that when you come out, yes, we all know the same clinical skills, but one, when you look for that job, you got to find what's right for you. The parquet might be fine for someone for the rest of their life. Babylon Dental Care might be perfect for someone, right? Not everyone's going to fit in that specific niche, but these are things that we teach them on the podcast.
And that's interesting because I've been, you've been with us, what, 4 or 5 months now?
I think coming up 5 months now. Yeah.
And you've heard me speak at team meetings and all that, and you'll be a part of the May event, which is really fun.
That I'm excited for.
Yeah, it's very, very nice. Deb's thrilled. So much work, but it's a lot of fun. And everyone appreciates it. It's a real nice, we close the office for the day. We go to Sunken Meadow. It's right on the water. It's a beautiful space and the energy's really high. And we kind of, we try to celebrate the wins of everything that we're doing collectively. Cause again, we're not an organization where one rises and falls. It's either we're all going to rise together or we're all going to fall together. So, that's really cool. But it's interesting that you're saying that because one of the issues that I have and why I really thought through my messaging this year in 2026 and came up with those 3 pillars of dentistry. Yeah. And again, dentistry specific to our practice. Okay. I think it's the ideal for any practice, but it's specific to ours.
Totally. Yeah.
Is the reason why I'm doing it is because it's very hard sometimes to talk to dentists about that because they think that their role is about the clinical aspect to their service, where it's the quality of the root canal or, the margin or the way that they put the crown in, the prep. I'm not a dentist, but
it's pretty good though.
I'm
you know
not
the terms
butchering.
pretty well. No, this is good.
I'm playing still. Yeah. I'm playing. I'm learning. So they don't really want to hear this other stuff. And that's where I can't take every dentist in because again, going back to the pillars, relational is the first, and I love that you said you like the order of relational first. Me too, because relationally, if someone sits in your chair, they're not necessarily having work done by you.
No.
Even when someone's in pain and it's urgent, there's still a moment in time where they're choosing you. Totally. So what are you giving them? How are you connecting with them to choose you? So the relational is really important. You got your clinical piece in, right? Yep. But the other thing that I'm very big on this year is the financial transparency piece, the transactional piece. Yep. That I think it's very important that dentists get comfortable understanding that dentistry is a huge financial commitment. Yeah, and a contract, we're in a contract with the patient. We're going to deliver X, Y, and Z. And your part of our contract is you're going to be compliant, take care of your teeth, and pay for the services rendered. I mean, it's like years ago, no one ever wanted to talk about money in dentistry. Like it was such a big, bad thing. But we're in a consumer business. Yeah. We service the consumer. The consumer is our patient. Totally. And it costs money to do that.
And you don't know what the patients are going through.
No.
Right. So when you, as a dentist, you think of, okay, this is the most important thing this patient needs. That crown is necessary. That root canal is necessary. But is that patient going through chemotherapy? Do they have children at home? Are they worrying about feeding their family? So we can't just be salesmen and just go, you need the crown XYZ. Yes, it's important, but we have to work with people. And that's why transactional is so important because it's like, we need to be transparent about our fees and understand the patient, which is relational. So if we understand who the patient is, what are they about? Do they live in the community? What do you do for work? Tell me about yourself. Get to know the person. And then when you add everything together, yes, your clinical skills are so important and you want to do the highest success rate, but you also want to work with that patient. And I mean, that's why I like the 3 pillars. Like you said, relational. Patient walks in the door, they sit down. How are you? I'm Dr. Rob. Great to meet you. Let's not talk about teeth. Tell me about yourself. Oh, you live in the area? You do this for work? Amazing. Do you have kids? You have a family? Tell me more. You know what? Now what brings you in today? It's the tooth. It's the upper left, third molar, upper left, second molar. Okay, great. Let's take a look. Let's test it. Now we have, okay, the tooth needs a crown. Here, the tooth needs a crown. At our office, it's roughly this amount. I'm going to speak with my PC, patient coordinator. Let her know what we need. I want her to come in, and this is going to be the rough estimate. Your insurance might cover some. It might not cover any, but she'll let you know the final price.
I love we used to bring PCs back in
Yeah.
Always. Patient coordinators would come in. Let me introduce you to Jocelyn.
Totally.
I love that as a patient. I
Yeah.
want to get back to that. It's very hard when you start getting big
Yeah.
like we
Yeah,
do,
it
but
is.
we're that was part of the workshop yesterday. We're going to get back there, but I think that's so respectful of a patient. And again, then she can go through
Yeah.
how they're going to pay for it, the hows behind it, which is really important. It's not something that you can do. But if you're still in the room and part of the conversation, if I need 6 things done
Yeah.
and I'm like, wait, I can't drop $12,000, you
Totally.
then have the opportunity to say to me, but what, we're going to stage this, Jenn.
And that's the beauty of it. You can stage the treatment. So for example, if someone has multiple cavities and one tooth needs a crown, instead of doing the crown, maybe I'll do the build up today because it's much more affordable. Do the rest of the cavities. And then when the patient's ready to afford that crown, you know what? We already took the cavity out. The tooth's stable. Yes. Is there a risk of fracture? Yes. But this is a better alternative because I'm able to get to the rest of the teeth and then we'll get to that crown when you're ready. So these are the beauties of actually having the conversation about finances because I need to know that as the doctor as well, because I need to know how do I stage this treatment plan to you and cater to that patient because every patient is different.
100%.
If you came in and said, listen, I have unlimited money, do everything you got to do. Perfect. You know what? This is what we need to do. Let's get the crown here first. Let's make sure it doesn't break. Then we'll jump to the cavity here. Then we'll do this. We'll get to it. But for everyone is different. And we want to make sure that we're doing the most ideal treatment plan for each person.
Love it.
That's what you got to do.
I don't know if Cliff ever told you he had one malpractice claim. Did he ever tell you this?
No.
And
No.
guess why?
Why?
Too relational.
Really?
I'll tell you why.
I didn't even know that'd be a thing.
Well, it is a thing in my world because I'm going to create it.
Oh, yes.
He had a patient, great relationship.
Yeah.
Again, all the things that you're talking about, patient couldn't afford treatment.
Totally.
So what he kept doing was putting the fire out on the tooth and not addressing. I can't afford the root cause.
Yep.
I don't even remember. It was honestly like 18 years ago, but couldn't afford what the patient actually needed on the tooth. So he kept putting the fire out to delay it until the patient could afford it.
Yeah.
The tooth ended up failing, and she filed a claim against him.
Wow.
Yeah.
I did not know
And that was way back in the day too, where you didn't really write those things down clinically.
Yeah.
And he didn't write that the patient refused treatment, couldn't afford it, or finances were an issue. So when he went in, So when we settled, the attorney said to him, did you learn your lesson? And he said, yeah, because Cliff is so relational. If the patient said, I can't afford it, he would always find another solution.
Yeah.
Not necessarily what he would clinically want for his wife or sister or that he liked, that whole thing.
Yeah.
But he would do that. He doesn't do that anymore.
Wow.
Yeah.
Oh
He
God,
used to be
that.
so relational that he would allow patients based on dollars to kind of guide him clinically. And he learned his lesson because he's a people pleaser.
Yeah. And I think I'm similar, honestly. Like I always give patients options. So I'll give you, here's the gold standard for that tooth. It needs a build-up and a crown, right? Here's your risks, benefits, alternatives. You know what? I don't want to do that. Okay, the next option would be a filling, but your risk is you're risking the tooth can fracture. I think as long as you tell the patients personally everything about that tooth and you tell them all the risks, all the benefits, all the alternatives, if that patient makes that decision and they know beforehand, I think that's okay. But then I can see how it gets to that as well. Because you can be so relational, think you have the relationship, but God forbid that happens one day. I mean,
listen, I never thought we'd have to get to the place where, I think, what's our x-ray policy? I think it's every 2 years.
What, for new patient exams, like full mouth?
No, doing a full mouth for
I
x-rays.
think 3 to 5, depending on insurance.
No, I think we require it if we don't get images on someone after a certain amount of time and they keep saying no, the patient denies. Doesn't want.
Yeah, I don't know that time policy.
Yeah, we actually release from the practice, and we've had a few, patients who don't want images.
Wow.
Which again, that's also back to what we were talking about earlier, not the patient not being well informed, and that's another thing. Like, there's a lot of dentists that I've met with and who have worked for us that have not worked out, that don't believe it's their job to inform the patient about why or what's going on in their mouths. They just think it's the recommendation, take it or leave it type of,
Yeah.
they want those types of relationships. And that
Totally.
doesn't work in our practice.
No,
You know, have you been doing wellness scans?
for sure. Definitely.
Do you pull them up in front of patients?
Oh, yeah. I love the iTero scan.
Yeah.
Listen, so you take x-rays. X-rays show like in the tooth, right? It will show if there's interproximal cavities. It'll show a cavity in the tooth. Wellness scans actually can also read that now, not to the extent of an x-ray, but a wellness scan basically is we take a machine and we take like mini pictures of your teeth in the mouth. No more gooey stuff, which is fantastic because patients hate that. And then it goes up on a screen and as a patient, you can see your teeth and your bite on a screen in front of you. So it also helps explanations because like when a lot of patients think the dentist is very subjective. You go to the dentist down the block, he needs a crown. The patient comes to me, he needs a filling. What is it, right? Let me explain to you all your options on this picture on this screen of your exact tooth and show you why the dentist on the block said it needs a crown and why I think we could do a filling or vice versa. You know, the amalgam, you have fracture lines. Does it need a crown? Potentially, it could fracture. Can we watch it? Yes, but that's your risk. So the wellness scan is amazing because it can really show and explain to patients what's going on in their mouth, exactly what's actually going on because it's a spitting image of their teeth. So I do use it a lot.
Yeah.
I love it.
Yeah, everyone's talking about it. I just had one done myself. And Dr. Sue actually, we're going to do new bondings on my front teeth.
Love it. Yeah.
So he showed me, and it was great because Cliff, we've been talking about, because I'm dental phobic, we've been talking about doing my teeth for, my hands are beginning to sweat, 13 years.
Wow.
Yeah. Yeah.
Wow.
So we're finally there. I had a little bit of an eating disorder, so all of my teeth up top are eroded and they're all bonded. And the bondings are getting worn. And it's like, how could I work for a dental place and not? Like, this is terrible. So I'm ready. But
Good.
David showed me the image of what my mouth's going to look like, and he's spinning it around where years ago Cliff did a mold.
Yeah, you do a wax up.
Yeah, wax up.
Yep.
And I was like, all right, I guess it looked okay. But this really looked like something I could see myself with versus the old wax up. So that would be so exciting because I'm sure you know sitting in that doctor's office, all those wax up, we got to throw them all out.
Yeah, they're good and bad.
Get rid of them all.
I think the best part about the new technology is we can take pictures of your face and also put the new smile on your mouth, and you can actually see what it could potentially look like.
Yeah.
It's not 100%, obviously, because things will change in the mouth.
Right.
But it gives you an idea of, okay, I could potentially look like this.
How do patients respond?
They love it.
Yeah.
They love it. It's the future of dentistry.
Are you able to give that to them to take home to show their better half?
You can. Yes, you can through Invisalign. There's ways of emailing and getting on the app for sure. But the best thing to do is after you do that is a wax up still, because then the patient will see it clinically with a mirror, and that's like actually me now. And the wax up, you don't have to touch teeth anymore for a wax up. You might think always you didn't, but you just put material, you put it on the teeth, you take it out, and you can see what your smile will be.
That's crazy.
And that's when the patients are like, wow, I want to proceed, or you know what, maybe we can change it here, shorten this tooth. That's the best.
So what are you loving procedurally? What do you love?
Procedurally?
You're all over. Like, you have so much energy. I'm wondering if you even have one.
Coming out of residency, so when I did residency at NYU, I was asked to be a chief there. And as a chief, the plan was to be chief resident, potentially go into endo, which is root canals. I liked root canals in residency, liked root canals coming out. But now...
I'd love for you to do endo.
Yes, but now I'm actually liking more cosmetics. So I'm doing less endo and now more cosmetic work. I'm finding that I love like the before and afters. It's something that really makes me so happy. So you can change someone's life drastically. Yeah. Like we just had a patient the other day come in, had a crooked tooth for 37 years. 2 teeth were fractured, a lot of bone loss. And we were able to do in the same day is to, 1, fix the tooth that was broken, how to get it out of the mouth, and also completely transition his smile and to make a perfectly straight teeth. That's great. And seeing that before and after and the reactions, it's more of like an emotional connection now. And I love that part. I love that part. Yeah. Are you
finding patients are going in that space? Because I think it's weird.
Mixed reviews.
Yeah, because
it depends how you get in that space. You can, I think people nowadays, so we'll rewind a little bit, but back in the day, it was more like full mouth rehab.
Right.
Back in the day, you want the Hollywood smile, they would call it. You'd come in, they'd shave the tooth down into these little pegs, you put crowns on, everyone's got the Hollywood smile. I would say nowadays more people are more conservative because everything's online now, so you kind of are more educated about your teeth. So people understand like you want to keep your natural teeth for as long as possible, if possible, right? I'm not speaking for everyone, but if you can do Invisalign and move those teeth into perfect orientation,
Right.
amazing. Then do some whitening. If you're still not happy, right? Because Invisalign won't change the shape of your tooth and the aesthetics of it. If you have a crack, you have a crack. If you have a chip, you have a chip. The Invisalign will just change, okay, where the alignment is in the mouth. So you still might have to do a veneer if you're still unhappy with that, or a crown if you have a lot of wear on the teeth. So yes, has it changed? I think Invisalign made a massive change in the dental space, where now general dentists are doing Invisalign, as well as orthodontists, to move the teeth into the perfect position.
Yeah, I mean, I think that it really when that came on the scene, and I'm seeing the doctors use it, I feel like it's less invasive. Like when Cliff was still treating and we started talking about my mouth, he was going to do all veneers.
Yeah.
And David, because he's of that Invisalign, leaning into that Invisalign era, he, even though I have such erosion that's going on, he'd rather rebond because he thinks the bonding is less invasive, than taking my teeth down to a crown, or
but nowadays,
even a veneer. He's like, the veneers are going to pop off.
But veneers, I mean, they're getting so good where it's like almost like a contact lens. A contact lens just goes in the eye. It's very thin. Veneers are so minimally invasive now that they're becoming like that as well. So as much as people are going away from your shaving down, the technology is getting so good, if you work with the right lab, that you can do a minimally invasive preparation and put a veneer on, and it will drastically change your smile.
Right. I think it also depends on the actual...
It's patient by patient, too.
Yeah, like I think the way that my teeth are.
Totally.
And the size and the biting and all that.
100%.
Yeah, David was like very conservative on it. Which
and if it works, it works,
Okay.
The pros and cons of bonding versus veneers is bonding gets more staining.
Right.
So going into that, that's something you should know. If you do bonding, you can get stain around the margins. Veneers look like your teeth. They're beautiful. Yeah. Is there cons of veneers? For sure. If they're not done right, they can debond. They can come off. Those are things that can happen. If you don't have the right bite and you're edge to edge or a lot of wear.
That's what I was, edge to edge.
They can come off too. So that's why people lean into, do Invisalign first, get that nice class 1 bite, and then do veneers because that's the most cosmetically, it's beautiful. And number 2, it's minimally invasive.
Right.
So
I want to get to your side hustle because the other thing that I thought was really adorable in our practice was when we announced, before you even came in and met the team, we announced that you were joining us. And there were like 3 or 4 girls that giggled because they had followed you on social media. And it was like all of a sudden a celebrity was joining us. So
that's great.
So talk to us about, and I have to tell you, and I don't mean this in disrespect. I just am not, I'm a little bit older.
Yep.
Maybe a lot more older. So I'm not on social the way that everyone around me is on social. So I wasn't following you prior to meeting you. So talk to us about what you're doing. Cause now I'm seeing you more and I'm loving what you're doing. I think it's so interesting and heavily relational, which I think you really are amazing about. But
I'll give you the whole background story.
Yeah.
So in college, I was a freshman in college. And my dad got me a job. Like I said, he's in construction in the labor's union. So I worked in the local 79. So I would sweep floors in Manhattan building with green dust, a broom, and that's what I did. That was my summer job. Long hours, wouldn't see my friends. He made me work all the overtime. So I wanted to find something fun for myself while doing this. So I went on social media, brand new. This had to be like 2014, 2015. And this app called Musical.ly was up there, and I joined Musical.ly, and I made these funny videos and had my dad in one. We were playing, both of us playing guitar in our boxers. Just funny, very funny. People watch it, they laugh. And I mean, blew up out of nowhere. And I think in like 3 months or 6 months, I had like 250,000 followers, millions of likes, and was top 10 on the app. Then when I went back to college and speaking to my parents, I think my dad went to work that next day and came back home and said, Rob, you got to delete that video. The office knows me. And he's like a construction guy. He's like your hardcore construction guy. Very professional job.
In a union.
Serious job. Built like some of the biggest buildings in Manhattan. And now he's in his boxers, like his tighty whities, playing guitar in front of the whole world, right? So then he comes home and says, listen, we got to take this serious. You're going to be a doctor. You're going to be a dentist.
And take me down
old school mentality. Yeah.
Take me down too.
Yeah. he's like, maybe we should stop making this content and focus on dentistry. You're going to be a dentist, right? So I was like, maybe they're right. Like, what if dental school sees this and I go for an interview and they're like, why are you in your boxers? Like, this is not going to go well.
That was pretty good because now they actually, that, right?
Now they like this.
No, well, no.
But they know you have this at least.
They do.
Yeah.
They now in dental and colleges and everywhere, jobs.
They follow your social media.
Well, they do a social media search.
They have to. They have to.
Because some people, like your content,
they take it the wrong
offensive,
way. Yes.
But some people
totally
have said things or done things that really wouldn't be representative 100%. Of NYU.
Yeah. And especially I think when you own a business, you should do a social media background to know if this person really aligns with what they say. So that
I didn't do that.
Yeah.
I know it's an add-on for my background checks, but I don't do it.
Yeah. We'll get to it. Now this new generation. But yeah, so that was the first thing with social media was Musical.ly. And that was huge. I stopped. So then I went through college, finished college, was in dental school. TikTok becomes a big thing. And now Musical.ly turned into TikTok. So I still have like that following, but no more engagement. No one knows my 18-year-old self now that I'm almost 30, right? So, I mean, not the same face.
Right.
So then
I don't believe it, but okay.
Yeah. No, not the same. It could be similar.
I'm sure you look exactly like you did when you were 18.
Yeah. So now fast forward to dental school. It was serious. Long nights, all-nighters, studying nonstop. Didn't have time to make social media. Always wanted to, though. I love social media. And I think most people in this generation consume social media.
I think that, unfortunately...
For multiple hours of the day.
Yes, I think it's where they get every piece of information that they have in their head.
Everything. And I think people, like, if they commute, when they get home from work, if they're tired, they consume social media. Me, I was always someone that liked to create social media. That was always been me.
You weren't a consumer.
No, I do consume because I like watching other content, but I like to create. I like to stay busy, right? So then at the end of dental school, I finished my requirements early, surpassed the requirements. I had some time, free time. I always loved music as well. So I was like, you know what? I can kind of bring back my social media presence, bring in music as well. So growing up, I played tenor saxophone, guitar, and piano, but I always had a love for electronic music. So at the end of dental school, I told myself how to DJ. I bought this little board. I'd be on the bathroom teaching myself what the buttons were like. I would go on the couch, teach myself after doing a crown prep from coming home. Then we would, after taking exams in dental school, we would go out and celebrate. And every place we went out to, I would go to the owners. I would find the owners. I wasn't in there to celebrate. I was in there to go to the owners and say, listen, let me DJ here. They were like, who are you? I'm like, I'm a dentist. I'm a Temple Dental student. They're like, you're a dentist? Absolutely not. Okay, next place. Finally, this place called The Blind Barber gives me a shot. He says, you know what? I'll let you DJ, but it's a Wednesday night. And I'm thinking in my head, a Wednesday night? I got class on Thursday. There's no way. So I said, you know what? I'll take you up on that. So it was a Wednesday night where I really didn't have much the next day, but I invited the whole dental school. So a lot of people showed up on a Wednesday night at a dental school. And we had such a great night. A little promoter. You have to self-brand. So then it did really well. We got moved to Thursdays. And then that was my last year of dental school. So I actually graduated.
Was this a paid gig?
Paid gig.
Wow.
Yeah, paid gig on a Wednesday night. Paid gig.
Side hustle.
So then I said to my wife, or my girlfriend at the time, I said, Perry, you have to buy me this board because I have no idea how to use their board. The first gig I had at the Blind Barber is I walked in there and the guy said, go set up. I had no idea where the power button was. I had no idea how to do this. Think about it. I'm DJing on a little fake board at home on my laptop. I have no idea. So I went to the bathroom, sat there, watched YouTube, and taught myself how to put the power button on this board.
Get out.
Yeah. DJ'd my first gig there, not really knowing what to do. So then I went home and I said, Perry, you have to buy me this board. She worked for KPMG for accounting at the time. So listen, it's $1,000. No, it's a lot of money. Can you give me this board and I'll pay you back from the gig money? And she did. She bought me the board. So at home, now the reason why I wanted this board is I can bring this board to the gig and just plug in my own thing so I can be perfect while DJing. And that's what I did. So I taught myself on this board. I paid her back the money through the gig money and then graduated dental school, went to residency at NYU, and now I'm back in New York where I have a lot of connections. So I got connected in the hospitality industry. And then I was asked to do these massive gigs. If you could bring people, we'll let you do these gigs. So then I did a couple of gigs in the city. One thing led to another. I didn't realize I would fall in love with music so much. Like I've always loved music, but something about electronic music, it was like creative. Instead of reading a book, I would go home after a long day and I would produce music and I would make music. And then I would learn how to mix music and make remixes. And I loved it. There was just like such a creative side. And then, then I started DJing all over Manhattan, all over Montauk, all over Long Island. I opened up for like the biggest artists in the world, like Sam Felt, Disco Lines, these massive artists that nowadays
that
have
I
like
don't
the
know,
biggest
but-
followings in the world.
Yeah,
Th-
that's
yeah.
not my music genre, but
Yeah, so I love it. I love house music. Always will, always do. And then one thing led to another. Worked in Manhattan, like I told you guys, for 2 years, very long hours. Then I'd commute back to East Islip. So I was doing like 10-hour days, 8 to 6, Monday through Thursday, and then 9 to 5 Friday, 9 to 6 sometimes, and then 9 to 3 Saturday. And I would commute to Long Island. So an hour and a half there, hour and a half back. So I didn't really have much personal time. So as much as I was doing these gigs and having fun with music, I always wanted to do content. So then when I came to Babylon Dental Care, I have a lot more time because my days, right? I have 7-hour work days. Mondays, I'm 7 to 2. Tuesdays, I'm 1 to 8. Wednesday, I'm off. So Wednesday's like my content day. Every Wednesday, and this is where I get back to the consumption of social media. I spoke to my mom about this in the car right here. Most people when they're home alone, right after a long day at work, they'll sit on the couch and they'll consume. Me, I'm the opposite. I like to create. So on my Wednesdays off, I will go to Manhattan and interview people in Manhattan in a park and just make content about, listen, why do you hate the dentist? And now I relate this to music and tell me, how can I decrease your dental anxiety by giving you noise cancellation headphones? And what song would you play? So now I'm relating both the dentist and the DJ side, because I incorporate music, of how to decrease your dental anxiety. And now this is the content I'm making for social media again. So coming to your office, not only do I love the team and what you guys done for me, bringing me on, but also it gave me my creative side back. And it's funny because in Manhattan, when I started doing social media again, I was concerned about how patients would interpret the DJ dentist, right? You're mixing both. Dental's very professional, white coat, serious. Mm-hmm. DJ's more party, club, drinking, alcohol, lifestyle. Why do I want my dentist to have this reputation, right?
Right.
But that's not me. I don't drink anymore. I don't do any of that. I just go out. I love music. That's my thing.
I think I love you bringing this up specifically because in sitting with you, I just feel like I understand what you're saying because
Totally.
I do have marketing background, so I was going there myself, and maybe that's why I wasn't really even paying attention to it for a long time. But I think it's just who you are.
And that's what it is.
And it's, you know, the fact that you are a creative and that's your outlet, that's your comfortability. I mean,
and
I'm a creative in ways that probably would not turn you on at all. I mean, I've got my parents' food for next week in the back seat of my car
because
I cooked for them.
That's amazing. Look at that.
Load of stuff. Shepherd's pie. None of that stuff's going to be your creative outlet.
No, definitely
but
not.
it's my creative outlet. So, yes.
But everyone has a creative outlet.
But I don't think it's a bad thing.
No, and I don't either. At first, I did. At first, I was like, wow, I don't want my patients to see me for who I am not. Right? Because I don't want you to say, I don't want my dentist out till 3 a.m. DJing at clubs and drinking and partying and doing.
Right.
But that's not me. I'm so passionate about the music.
Yeah.
It makes me happy, right? Like if someone after work goes and plays guitar, goes and reads a book.
Right.
Goes and consumes social media for 2-3 hours, right? That's great. Those are your hobbies.
Right.
Those aren't my hobbies. My hobby's more, let me come home and actually make content for you to see. Right. I want to educate you about dentistry. I want to make music. That's my happy place after work.
And you're really, and it's very rare. I mean, the fact that we opened up with your sense of family and all of these things that are woven into who you are as a person, that's not the norm for people your age. It's just not.
Yeah, no. No.
But I think that it's just for you another space that you can connect with people.
Yeah, and that's the biggest thing.
You really are a high people connector.
I love people.
Yeah.
I love meeting people. I think my mom always told me to enjoy the simple things in life, right? And as a kid, I never understood it. I always like, what do you mean? It's a boring life, right? But I do get that now. I mean, the little things in life, just connections with people, getting to know them on a deeper level, that's everything. I mean,
I've been saying that forever to my kids. I'm always like, I feel bad. Like I grew up in Hop Hog, which isn't far from Islip, and we rode bikes to everyone's house.
Yeah.
Like we didn't have, I never had a watch on. I never had a cell phone. Yeah. We rode bikes, it got dark. And so my curfew was what, 9:30 in the summer, but it was very simple. It was a very simple existence. I mean, there was drama, but it was a simple existence. My kids didn't ever have that. And they're all connecting instead of riding their bikes and going to a friend's house in the neighborhood.
Yep.
They're connecting through a media source.
Yeah.
Which
they all are now.
Which is a little bit strange, and it's different because what happens is, my belief, and I don't think this is with you because I think you're very different than most people your age. When you're connecting through a media source, you don't develop that people skill.
You don't.
Or the appreciation of interacting like this in this forum with people, and especially in, again, you're the dentist and then patients in the dental chair. Those spaces are just not comfortable for people.
And I totally agree with you. Like when I look at, I have a lot of nieces and nephews, right? And their generation is more social media consumption, playing video games, and it's not interaction one-on-one. Like me growing up, I played sports my whole life, soccer, basketball, anything with a ball, you were playing. You were outside in the yard playing nonstop. At the end, you'd have pizza at your friend's house. You were constantly interacting with people. Nowadays, it's not like that. So I told my nieces and nephews recently, I said, listen, you can consume social media, it's great, but go and make it. Like go and be that person that with your friends, have fun with it.
And then
bring
have
your friend
an
over.
engagement. Yeah.
Make content that you guys can bond over, you and your friends. It's more engaging, it's fun. And also now you're not consuming it, right? Because it's called brain rot. That's like this new generation calls it. Yeah. You're just scrolling 15 seconds. What are you attaining, right? The attention span just go decreasing. 15 seconds of constant scrolling. You got to teach yourself things first. You got to have fun and make sure you're engaging with other people, because there's negatives to social media,
There's a lot.
There is.
There's a lot.
But what I'm trying to do, and I'll get back to the new content now, is I'm doing interview questions in New York City. Is I'm trying to bring, and who I ask are patients, right? I'm not asking dentists. I'm asking people in a random park. Tell me about the dentist. What's your dental experience like? Most people hate the dentist. And going into this, I know that.
I just saw one the other day. They were in costume. I don't know, when did you?
A carrot.
Yeah.
Levain Bakery, actually.
Yeah.
That
was funny.
Interviewed a carrot. But yeah, so I go to these people and ask them, do you like the dentist? Most people are like, no, I don't like the dentist. Right. Most people say, listen, I have lunch break. Can you please shoo off? No, totally fine. I'll get to the next person. But then when you get to a person that wants to have conversation, which I would say like 70% do, then they open up about their dental experience. And I say, tell me why you hate the dentist. At first, they're a little shy, timid. But as you get them opening up, like, how can I help your experience? Or give me advice for my patients that would make your experience better. They do have ideas. And they tell you, listen, I think, giving noise cancellation headphones would be fantastic in the dental chair because I hate the scraping noise, right? Making the rapport, the relational, because like my dentist, they just go do a crown. I have no idea what they did. Right. Okay, so now I just learned from these random interviews is, 1, headphones. People have dental anxiety due to noise. Number 2, relationship. Let me actually have the rapport for patients prior and tell them their risk benefits, alternatives, of what's going on to make that experience that much better. So the interview styles, and then at the end, I always relate it to music because that's the DJ dentist. I say, okay, you're in the dental chair, you wear noise cancellation headphones. What is your go-to song? And there's so many different ones. Some people like Beethoven, some people like Miley Cyrus, some people like house music, which I love as well. And what I'm going to do is after all these interviews, say it's 100 or 1,000 or 5,000 interviews, I'm going to make a massive playlist of songs that everyone has recommended. And you can search up the DJ Dentist on Spotify or Apple Music. And there will be the 5,000 songs or 100 songs or 1,000 songs that these people said that they listen to in the dental chair.
We'll have to definitely get Sonos in that office so we can play those lists. No, I mean, it's people that I love the music correlation because we've done events where we'll send people, what song makes you dance? What song makes you think of this? And we take everyone who's attending the event, we take all this music and we do a thing on Spotify. They get so jazzed about it. And it's like,
great.
And I'm like, I actually need this. It makes it easier for me if you guys create my playlist of what I'm playing when we're not speaking in the background. It makes it easier for me
100%
to have, but I love that they're all contributing to, because again, like I remember growing up and I was at a stoplight and I just spoke it to a boyfriend and I ended it and Firehouse came on.
And you went to a song, right?
Yes. We all do it.
There's emotional connection to music. 100%.
We all do it. My dad, like Suspicious Minds, I mean, I just always go there with people and events and, your wedding song and things, high school, I mean,
and that's my
by
theory
the way,
too.
what's happening right now with Iris again? I mean, it's the it's a whole movement, which by the way, I really do think that song was in the 2000s, early 2000s and not in the 90s. But, and the craziest thing for me is every time I'm seeing those videos, I am stopping and watching, and I am reminiscing because I was alive in the 90s.
Totally.
And I like seeing all of those people in those shots on the 90s. And I literally am writing, I love this, thank you, to all of them, all these celebrities who I do not know, but I love reminiscing and seeing them in the 90s back when I saw them in the 90s, because it really was a fun time. But
and I think that's the beauty of music, right? Like everyone has an emotional connection with a song. For every emotion, right? I listen to songs that I want to make me happy. When I don't have the best day, I listen to songs that want to just like match my mood, right?
Right.
When you're in the dental chair, you have dental anxiety. There's definitely a song you're going to. Everyone has their own song they're going to go to play.
Right. But how many of them actually have the opportunity?
I would say many don't. They don't even know it's an option. And what's cool about the new headphones is you can either do noise cancellation or transparency mode, which I like for patients because then I can still communicate with patients.
Right.
So you can turn on transparency mode. You have a song playing, but you can still hear me. So instead of like tapping on a shoulder 9 times and their patient's freaking out, like, oh, did something just happen? No, it's like, hey, Mrs. Jones, Mr. Jones, are you okay in the chair? Yeah, no worries. You're still listening to that song. So it gives you that chance to still communicate with the patient and have music on, which is great.
Years ago, when I first started my dental marketing journey, do you remember Mrs. Fields cookies?
No.
Oh, goodness. We're going to have a hard time together. You don't remember anything from my time. Anyway, it was Mrs. Fields cookies. It was like a big thing.
Yeah.
There was stores all over the place. They were selling this concept, and this is crazy, but this is, again, moving fear of the dentist to something else.
Yeah.
Baking cookies in the office and having the smell of cookies would desensitize the anxiety or the nerves to move to like that feeling of homey and being in a house. I mean, they do it too. I know in the real estate market when people are having open houses, sometimes they'll bake something so it's very fragrant. But they did that for a long time. And Cliff was like, let's do that. I'm like, where? Like when? We're so busy with like patients.
100%.
Who's baking cookies in the middle of this whole...
Get a full-time baker.
It's crazy. Like, I could not get around it.
Yeah.
I don't know how Mrs. Fields and the dental world made this synergetic, relationship and what the profit was for whom. But I was like, I got the concept, like smell is definitely, I think, for me, I do equate, because I have also, not only do I have dental anxiety, I have medical anxiety. So I am very sensitive to very clinically smelling environments. They do trigger me. So I was going there, but I couldn't figure out a way how to implement it in our practice. So that flew. But I love music. And it was one of the reasons why when I went and build Gateway that I gave it was very costly to have Sonos where they can, each operatory could run on its own and have a music selection.
Their own music selection.
Which was a very, very big thing. And truthfully, it's the reason why we're not necessarily installing it in West Babylon. If I told you how much it was, you would...
Yeah, I'd probably fall off the chair.
It's a lot.
Yeah, the next thing, if we get this, you might fall off the chair too, but the next thing I want to get to is AI. And I want to really implement. This is like my dream and my goal.
Let's talk about it, because Henry Schein talks about it all the time with me. Even, I don't know if you know the insurance plugin that we have.
Oh, yeah.
Yeah. Okay. You've been using them?
No, but I saw it with you guys. That's how I know about it.
Yeah. So talk to us.
AI for me.
I'm not panicking on it.
No.
And by the way, it's not a big spend.
No. Yeah. I don't know about this, but I want to bring AI or augmented reality to the patient experience as well. So not just headphones, but if I can give you goggles to wear and make you not even be at the dentist, like you're at a safari or you're at the beach.
You could do that.
100%. And you have no idea where you are. The Apple ones are pretty expensive. You can have them
What's
come
pretty
in.
expensive?
Let's say $3,000.
Oh, that's pretty
to
expensive.
$5,000 just for one headset.
Yeah, that's pretty
It's
expensive.
pretty expensive. So, and you wear this headset, and I tried it the other day,
Yeah.
right? So let's say you have your iPhone.
Could we get your wife now to buy that for us?
Yeah, I'll try. Yeah,
Okay.
then we'll give her back the money
We'll
later.
pay her back, yeah.
Yeah, eventually, just like the board.
Just like the board.
But you can take a video, for example, of a birthday party,
Yeah.
right? Let's say it's your dad or your mom's birthday party, and you want to cherish this memory and
Okay.
relive it every day.
Right.
You take a recording of them blowing out a candle. You put on this video on these headsets. You are at the table with mom and dad blowing out a candle.
I love that.
It's not like your phone. It's you feel like the smoke on your face. It's like 4-dimensional. It's incredible. So these patients, they come in,
Right.
they have dental anxiety. They can have a selection of, okay, what would you like to watch? I wouldn't give a scary movie because God forbid I'm drilling and they go up. I would never do
Yeah.
that. But something relaxing, right? Like
Right.
if it's like the beach or a safari exploring or whatever calms their anxiety, they have these on the goggles. And also it has a headset. So you have music or you have anything you want that's going in the ears.
Sure. You're physically there.
You're physically in this world.
Space.
You're not in the dental clinic, which
I
can
love
help. And I want to try it on patients soon. So hopefully we can get to that. But it's an experience.
Well, I mean, it's got to be a new technology. I'm going to assume
Yeah, it has to be.
Eventually prices will be more.
I think they'll drop eventually once they
Yeah.
get there. Like you have Meta coming out with glasses that people wear
Right.
that records
I mean,
everything.
we started that years ago with putting the screens in
Totally.
front of every,
Yes.
and we do have the availability to watch Netflix. And
Yeah.
then people weren't really doing that. And I was told that the, just general cable was very distracting. So
Yeah.
we made it more of the inspirations, which, believe it or not,
And I do love that as well.
by the way, we still get patients who like screenshot their inspirations
I love it.
and then put it up on social media. Like, because, again, when you take someone out of the space of being in the dental chair and
Yeah.
they're being inspired by words, they're thinking something
Totally.
other than what's actually happening.
Yeah.
It's really cool. But yeah, I mean, I'm not opposed to any of that. I
Yeah.
would like to make it more
And this is not for every patient.
economically
Yeah.
friendly.
It's not for every patient, but a patient where it's like, instead of going under anesthesia, right? Maybe this can help, right? Maybe you can save them this massive amount of money from like, you don't need to be put under. We just have to find
Now
your anxiety.
that's something to build out.
We have to find your anxiety and help you calm your anxiety and make you actually love the dentist again.
That's
and build
something
your
to
trust.
build out. That's something that then we can create it and the patient would buy into that dental reality.
Yeah. Because I think it's as a whole, like when a patient enters the office, they hate the whole experience, a lot of them, right? They hate the whole where it's like
I think
the noise, the drill, the scraping. I mean, the smell, dental office, the smell, everything, like you said,
Yeah.
everything about the office, some people really hate to the point where that's like, you know what, doc, you got to put me under for any treatment. If I can win you back, win your trust, win any way, and if this can help where you can leave that world and go into a different world, I would love to try it.
I'm open to it. So that would definitely, I'm getting prompts here from Deb talking about the category 1. I feel like that
Yeah,
would
that could be.
definitely make us a category 1.
100%, yeah.
Even though I think we already are.
I think we are too. Yeah.
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 Did you ever hear that philosophy before?
Tell me about it.
Category 1?
Yeah, tell me about it.
Did you end up reading the book before you were hired?
No,
Oh,
no,
I was wondering if
I
you
did not.
Did we send it to you?
you did.
Okay. So, I mean, I love the
You sent it to me after I got hired, though. So I didn't read it before I was hired. So.
Did I? Okay. I love the category 1 philosophy because I think that my belief is that, anyone who comes to our practice probably passes 3 or 4 dentists on the way.
Yes.
And each person they pass, they're like, oh, Sue goes there and, Stu goes there and Ryan goes there. Like everyone knows who goes where.
Yeah.
Why are they still driving to come to us? And
Totally.
then you might throw in, well, Babylon Dental Care no longer takes our insurance. Maybe I make a decision to move or I make the decision to stay. Because I do think that, and this is a hard thing for dentists to understand, dentistry is a choice. I think it's a choice for everyone.
Totally.
I don't think that society and mainstream media has taught us that dentistry really isn't a choice. It's a necessity, just like major medical.
Yeah.
I think that, when people go to book their appointments for the year, I think they definitely go there, if they're a woman, gynecologist, general practitioner, right? I don't think that they always add in dental.
It should be a necessity, though.
Mammo before dental.
It should be a necessity.
Yes, but I just don't think that your dental societies and
Yeah.
just public awareness is out there that dental is one of those.
But I think also fear plays a massive role.
100%.
Then you get the opposite spectrum,
Yeah.
right? Where you have patients that come to the dentist more often than their primary care physician.
Right.
So that's where, like sometimes like in dental school, patients, when they have a tooth infection, you have a tooth infection.
Right.
So their first visit to a doctor might be the dentist because they have a tooth infection. Not that they want to come to you,
Right.
but they have to, right? They have to get a
Well,
pain.
the emergent.
The emergencies, right? So now they're in your chair. You can now find if they have high blood pressure by taking their blood pressure,
Right.
diabetes by the smell of their breath, right? Their periodontal disease might be so bad that it might be something more systemic, right?
Yep.
So you can be that quarterback for that patient and direct them towards the next step. Not only treatment of the teeth,
and airway health.
Airway health, 100%. Clenching, grinding, GERD, reflux disease. You can see this in the mouth. And then, like I said, as a general dentist, you're the quarterback, which this is why I love the career. And you can get them help in not just the dental world, but their systemic health.
But I don't.
That's the coolest part.
But that's, and I'm glad you love that because that was always Cliff's philosophy. But I think that most dentists don't look at it like that.
Yeah.
They don't understand that one piece of what they're doing is factoring in all these other.
Yeah, it's got to be comprehensive.
Yeah. So, the category 1, I think that it's, for me, and I've lived my life like this in everything that I've done. And I want it for this practice where we're in a large category, but I want to trailblaze and be something really, really special.
Yep.
I want patients to be really proud and back the decision that they make to choose us time and time again.
Yeah.
I want our staff to feel that they're chosen to work with us because they're extraordinary.
Yeah.
They're very special. Like we don't have mediocrity. We don't.
No.
It does. They actually flick out on their own.
Yeah.
Because they just can't survive because of all the things that we're doing. Again, you have to have a certain mindset to work for us.
And a certain personality. I see it. All the hygienists are amazing.
Oh my
That was one
gosh.
thing I've noticed when I came to this office.
They are a strong group.
They are incredible. Yeah. They're incredible.
And now, and with Gabriel too, it's like amazing.
It's great. All of them.
And you know what's so nice about them? This makes me proud if I take a celebratory moment. They're all having babies and going, like we had a group about 5 to 10 years ago that went through this. And now this younger group, they're all going through it.
Yeah.
And if you see, them on social, they're all going to each other's weddings and baby showers and meeting the babies for the first time. That's really special too.
That's great.
To create that environment where they're not just coworkers, they become friends.
Yeah. And that's the feeling you get too when you're at the office.
Right.
Especially at the doctor. Like when I go into these rooms, I see like if one patient canceled, there'll be another room together. It's like you're building these friendships too that last so long through the office.
They're so blown away. All the girls are like, I can't believe how many patients are giving me baby gifts. I'm
That's
like,
amazing.
When I had our daughter Emily, the crib was filled with gifts from just patients.
Wow.
The crib was filled with gifts before I gave birth from patients.
Wow.
He'd come home every day. I'm like, who gave you this? He's like, I don't know. They wrote it on a note card. I'm like, I can't keep track of it
awesome.
all. Like it was like everyone was celebrating because of, again, we are that category of 1. And
It's the culture you created.
yeah. So I align myself a lot with that message.
Yeah.
And I think everyone has. I mean, you see them, they're constantly shouting out green apples. 100%. That's the other thing, part of the category 1, like, in a bushel full of red apples, what are you doing to be the green one?
Yeah.
That really, really special apple.
Yeah, I love that.
They picked up on it.
I love that.
It popped to mind like in 2024. I made a little announcement at the holiday party. We're going to talk about it at 2025, and now it's like a movement within our practice.
Yeah.
And I like it because they're creating that standard for themselves.
Totally.
And they're moving it up.
And you want to reach that.
Yes.
Like you want to see your name in an email.
Yeah.
You do. It's exciting.
You do.
When you say,
You get shout outs.
Sometimes, yeah. I love it. I get excited.
It's nice. Yeah. Well, then you got to scroll through the 57
emails to get to the one that's important.
Well, it's like the welcome email.
Yes. Oh my God. Yes.
I don't know if it was you or someone.
I spoke to my wife about that. I'm like, oh my God, I just got 63 emails of everyone saying welcome. I was like, this is insane.
I had a doctor I hired, and he texted me. He's like, what do you do about, what's the etiquette for these emails? I said, what do you mean? He's like, the welcome emails. Should I right back to each one of them. And I'm like,
Could've been
no,
me.
just hit reply all. Like, let them go for a day or two because you're probably going to get into the 60, 70 number.
It was insane.
And then just hit reply all and
That's
thank
amazing.
them. He was like, I don't know what to do. It's like a lot of emails.
No, it was a lot.
Yeah.
But it felt good. Like, wow,
Yeah.
it felt like some people cared about you.
Yeah. So like my birthday, when they send me birthday, I do respond to each one privately, but because,
Yeah, for sure.
I take the moment, but on my birthday, but everything else, I'm just like, thank you all.
100%. It's a lot.
It's a lot.
But it feels good.
It's wonderful. And the fact that they're not prompted to do so.
No, that's the thing.
They're doing it because they literally are jazzed by something that someone did or
100%.
how they showed up, and they want to shout it out. I love it. So,
Yeah.
What else do we need to accomplish before we wrap?
I think we had a lot of points. We hit the podcast, truthfully speaking. We hit this podcast.
Yes.
Hit music. One thing about music is, so what inspired me, I told you I played a lot of instruments growing up. My dad was in a famous band.
Oh, I didn't hear this.
Totally forgot to tell you about this.
Okay.
Called Ichabod Crane.
Ichabod Crane.
Ichabod Crane. Played in a famous band. He was the bass guitar player.
Okay.
They opened up for like Billy Joel. They opened up for like massive, massive artists.
Okay.
17,000 people in the crowd. I mean, he was huge. And then...
This was before he went into construction?
Yeah. It was before. So no, Ichabod Crane, they got that name because Ichabod Kane was big back then, that movie. And they did Ichabod Crane.
That's before my time.
Yeah, then they did Ichabod Crane because crane, like construction cranes.
Oh.
So it's kind of like my DJ Dentist, how they interpret both my worlds. They put up both the construction and music in their both world.
Did you write this in your bio?
No,
we got to redo a bio for him.
So now Ichabod Crane was the band. They were signing with MTV Studios. MTV Studios was late to the interview. The lead singer apparently thought who he was.
Right.
And left. So they never really went anywhere after that.
Wow.
So then they all went into construction. All of them work in construction.
That's so funny.
They went their own ways.
They don't play at all?
They do now.
Together? Oh, they do.
They're back now.
And they go to like
They're
local bars?
Yeah, now I told them to change
like
the
Lily
name.
Flanagan's or something?
They play all over Long Island now.
Yeah.
I told them to change the name for social media to Ichabod Kane now.
Yeah.
Because they're older.
Right.
So they all come out with canes.
Oh, I love it.
And then rock and roll.
We could probably do a good graphic for them.
Yeah, I think it'd be great.
You need to though one night get everybody from the office either to one of your DJ things or go listen to Dad, or maybe you do a blending.
Yeah, we should do a blending. We've done one blending, me and my dad once.
Yeah?
Yeah, once.
I love it. Where was that?
That was at a winery.
Okay.
A winery out east. I forget which one it was. But I DJ'd in the beginning, and then his band came on and played.
I love it.
Yeah, it was
Very
great.
nice. I don't know. I don't know what else we can talk about today. I think we did some great things.
Me too. This was fun.
I'm really happy we got to connect. I know we're going to dinner after this too. But I'm really happy I got to learn a little bit more about you.
Yeah, I love this. Thank you guys for having me.
You're welcome.
This was a lot of fun.
I really, I get a little spiritual, so I do believe that things happen for a reason.
100%.
And I do think that where I was going in my leadership journey was manifesting someone to come into our practice just like you, because you're so in alignment. And I will tell you, not to get like really crazy, but I do feel that I'll learn so much from your space as a provider and as a connector and all the things that you bring. I think it exceeds anything that I've even had in my head for where I wanted to go. So I'm really excited about it. And one of the things too that I'm uber excited about is continuing to watch you grow and get comfortable and then help others who might be struggling. Because I do think that most doctors are not always comfortable jumping between pillar to pillar to pillar, going from relational to transactional. I mean, all of relational, clinical, and transactional, all of that is like infused with trust and love and, goodness, good stuff. The transactional doesn't have to be like the gritty, icky part
Yeah,
of
no.
dentistry. No, it's all about how we serve and how we connect and communicate with the patient so they
Yeah.
can make informed decisions that are best for them clinically, financially,
100%.
physically, all
Yeah.
of that stuff. So I'm very excited. I feel like you're just a perfect match for us.
I appreciate
and
that.
I look
Thank you.
forward to, helping you along your way
Yeah.
and anything that we can do to support you and
Thank you.
celebrate you.
Yeah, no, I feel the same with you guys. I mean, I'm learning
Good.
so much with you guys too, especially
Good.
Dr. Brown mentoring me and helping me through, everything he's teaching me, which is great.
Yeah.
And then one last thing is
Yeah.
is the positivity at the office. That's one thing everyone should bring every single day. I think
Yeah.
life's too short. Every day you gotta have a smile on your face. And you just go in, give 100%, shoot for perfection, and it's all about progress, right? You shoot for perfection. If you can get 99% that day, that's a win, right? So just be positive, smile, make your patient smile. And what I want to do is make patients dance on and off the dance floor with a smile on their face, especially in the dental chair. That's
I
it.
love it.
Yeah.
I love it. Well, thank you for coming
Of
on.
course. Thanks for having me.
It was good to have you.
A lot of fun.